Okay. Hello, everyone. My name is Olanka Aremu. I'm a registered nurse, midwife, and public health nurse, and I reside in Ireland here, and I practice in emergency department. So today, I'm going to be talking about the topic postpartum sexual health. You want to wonder why is she talking about postpartum sexual health? Why is she not talking about emergency or something? That's because I started writing a paper way back and trying to round up this, and I decided to share this with you as well. A friend of mine sent me a particular message asking that I try to speak on certain things that pertain to or challenges of women postpartum, and as well what they feel, what they face in childbirth. So this topic is a very good one, I suppose, at this time. Another thing I realize is that a lot of women try to be quiet and silent about the challenges that they go through. So this discussion will serve as an opportunity for women to be able to express their need for improved sexual health, especially after birth, after childbirth, and also it will also create awareness for the men and the public on the challenges and the difficulties that women go through after childbirth. I hope this will be an eye opener. So, thank you once again. I greet you. So, I would say, why postpartum sexual health? Sexual health means making sure that you have the knowledge, skills, and ability to make informed sexual choices and acting responsibly to protect your health and the health of others. It is now we know we have a general well-being, a general health, but sexual health is an aspect of your health, general health. So it involves you making informed sexual choices and acting responsibly. And it includes a lot of things, like when you're talking about contraception, you're talking about abstinence, you're talking about what will I call it again, you're talking about breastfeeding, you're talking about a lot of other things, personal hygiene, sexual health hygiene, and all that. So, and it also has to do with the sexual relationship uh, in a marriage or between a man and woman after birth. So, why are we talking about this? Just going to, like, I'm doing definition of some terms. I've defined sexual health, just that's the best way I could define it in a layman. Like, you trying to make sure that you have the enough knowledge, skills, and ability to make those choices that are, of course, informed. That is why this information will be coming to you now. So, as well, postpartum. Postpartum period is the period beginning immediately after the birth of a child, and this can extend for about 6 weeks. So, it's usually a time after birth, a time in which the mother's body, including the hormone levels, the uterus size, returns to its non pregnant state. So, during this period, there can be an expression of sexual urge, sexual relationship that you want to meet. So, how do women cope with these challenges, coupled with the fact that they've just given birth and there might be complications and all that? So, these are the things we're going to be talking about today. So, firstly, just going through my slide there now. Sexual health, I want to talk about it. I'll just run through it. Sex during pregnancy, and then sex after childbirth. There are a lot of theories, a lot of discussions on whether it is right for a woman to have sex during pregnancy and all that. I want to ask you, like, will you want to have sex during pregnancy? Now, okay, do you have sex during pregnancy? Okay, I can answer these questions myself as well. So, most of the time, it is perfectly safe to have sex during pregnancy, except if it is contradictory, maybe contradictory, or maybe your doctor, your GP, your caregiver advised against it. If you are maybe you have a high risk pregnancy, so you might want to check with your doctor about this if it is safe for you to have sex during pregnancy. So because different women have different feelings and have your interest in sex may decline even in pregnancy, or it might even grow to some women. That is their heights, like, of the sexual, of the libido. So it depends on you. So what is important at this time is you and your partner, we need to talk about what feels right to you. Like, there is no point keeping silent about it. That's what we're talking about. You need to express yourself. So as the pregnancy advances, intercourse may become very uncomfortable. Yeah, a lot of people will start advising about what style can you use, and we're not going to talk about that today. You know yourself. So which one is more comfortable to you? What approach do you, how do you express your sexual desire to your partner, to your spouse, your husband? Or, during this time, both of you have to have a common understanding about this. Now, before I go into the next, I want you to share your experience. Write it in just put it in a writing or as an audio, whatever. We want every woman to experience. We want every woman to learn from this. What is the experience of sex during pregnancy? How were you able to cope with it? What are the challenges you faced and all that? Were you even able to have sex during pregnancy? So you may want to try other sexual activities or explore new positions. You have to be creative, just find what is right for you and all that. Now, the next one is sex after childbirth, which is the main focus of today. The months after giving birth, they're very challenging. You agree with me? I had some challenges as well. A lot of factors. We're going to talk about the factors as well. So the demands, of your new life, of having to take care of the child and all that, they are very, very enormous, and it brings about this, these changes. Some couples feel that sex is an important way to make time for each other at this time, but others will not. So women may feel, sometimes you feel so touched out, like you're so exhausted after taking care of the baby, and you're just overwhelmed by all these new responsibilities that you don't even have that feeling. You don't have that urge, you don't have that desire for sex. And then if the other husband asks you, sex? You mean? And so all right. So question I want to ask, when is it safe to have sex after childbirth? A lot of people that ask this question, I expect you to ask it. As you're reading this, if you're watching this, I want you to please share this video to a woman, to a man, to anyone that can benefit from this. Let this video go viral, because it's high time we understand the challenges that women go through after childbirth. A lot of things are involved in this. So, when is it safe to have sex after childbirth? uh Personally, I'll say physically it is safe to have sex after the lochia. So what is a lochia? Lochia, it's that vaginal bleeding that occurs after delivery. So as soon as the lochia stop, it it is safe to have sex. But of course, like I said, it depends on the circumstances surroundings. It depends on the situation of the woman. So having sex before the lochia stops could put you at risk of a serious infection. Yes, because at that time the body is very susceptible. So it has to come with an understanding. Your partner needs to understand. Men need to understand that if you are so, like, the sexual urge and all that, if you can't control yourself at this time, you might be putting your child at your wife at risk of infection. So I'll advise that um having sex should be after the lochia stops, as the vaginal bleeding stops. Also, sex may be very uncomfortable at this time, especially in the first weeks. Some women will have pain around, the episiotomy. I had an episiotomy done twice in my childbirth journey, and I know what I felt like even after childbirth, or even with cesarean section. A lot of women, please, like I said, share your experience. How did you feel? What were the challenges you go through? It's time for us to talk about these things after childbirth. All right. So we continue. Why scars are formed in this area? Like, sometimes you have scars formation there. How do you resolve this? What are the things you do? Another problem that also comes up sometimes is vaginal dryness, which is very common if you are breastfeeding. Yeah, if you are experiencing this, or if you've experienced this, just leave a comment and let us know as well. So the hormones of your body will produce milk that reduces your ability to lubricate. So you should understand this. So I want to say, whatever thing you are feeling, whatever thing you felt, and you felt like, oh, why am I like this? I tell you, you are normal. Say to yourself, I am normal. So like the water-based lubricants, like the body produces, it goes slow and it gives the body more time to lubricate during this time. So the hormones are stimulated by orgasm, and all this hormone can cause your breast milk to flow. So don't be surprised if you need towel. So what I'm trying to say is, the more your the hormones are produced in your body, the more you breastfeed. Some women will also have increased what will I call it now, sexual urge, but some it might be reduced, and you can have vaginal dryness just because of this as well. So the context of postpartum sexual health, so to say, can be when we look at when you're talking about factors that associate with resumption of sexual initiation. So when do you commence your sexual relationship? When? So put a comment there yourself. How frequent do you have sexual intercourse after childbirth? What do you have desire for it? What do you have ability to achieve orgasm? Are you aroused? Some women will experience pain during sexual intercourse, dyspareunia, and some have no satisfaction with sexual relationships. So, whichever situation you are with this, I tell you, you are normal. So, those are some of the situations that can arise. Now, another thing I want to mention here is birth control. Birth control. So, what contraceptive method is suitable during postpartum period? Like, because we have cases of women, if you're in this category, like I said, it's normal, so you are normal. So just share your experience of this postpartum pregnancy. That's what I mean. So it is important that we take measures to control pregnancy at this time, because like 10 days after a woman gives birth, research have shown that literatures have shown also that a woman can get pregnant. Yes, that is true. So you need to also think of birth control as a means of improving your sexual health postpartumly. So you might also need to talk to your doctor or your healthcare professionals about what form of birth control can be best for you. So like I always say, don't copy from one woman. What work for one person might not work for you. Now, the hormonal changes after pregnancy may affect some women's sexual desire, but this is all usually temporary. So it is important that you have an understanding with your partner about about this process, or about this time, this transition period. That is why I said, please share this video, share it to men, share it to women, so that they will have an understanding and awareness of this. It is not a time that the man will feel like, oh, my wife is not satisfying me, then I have to go outside. We have cases like that. So we have a lot of cases like that, and it's just boys that I would say it like being selfish part of it. But if the man understands this, that this woman is going through a transition period, then it's going to save a lot. So some women may also be self-conscious about their bodies, like they don't even have an understanding of what goes on in their body. So it is important for your partner to be loving, supporting about the body changes that might occur. So I'll go ahead. What are the factors affecting postpartum sexual health? So there are two major. There are a lot of. I'm just going to stay on two of these because of time. Mode of birth, can be the type of delivery. So the type of delivery that a woman experiences now also determines the the postpartum sexual health. So for a woman, for instance, we have two types: spontaneous vaginal birth, and then the cesarean sections. So I'm going to say here that research have shown that like there is no significant relationship of between the expression of sexual health, either you had a vaginal birth or for cesarean section. It does not matter, because I've had a lot of cases, a lot of people share experience that if you have vaginal delivery, it can affect the libido, that means the sexual drive. It can affect the level of arousal and all that. So It depends. Like I said, share your opinion or share your opinion about this. What do you think? But women generally express their sexual health differently, irrespective of their mode of delivery, irrespective of their type of birth. What is important actually is that your partner must understand the transition period that you're going through. Okay, so another thing, if a woman, however, has not resumed sexual activity at this time, she may be unaware of any potential problems and discussions. So a woman as well need to be aware of the changes that happens in her body. So another factor that affects is perineal trauma. Yes, perineal trauma in the case of probably a woman experiencing had episiotomy. Like I said, I had episiotomy in my two pregnancies, meaning that they had to cut the vagina to make it wider for the child baby to come out. Some can be spontaneous, like I said, and some may actually be induced. So it depends. Is it a spontaneous tear, or do you have to get a suture and all that? So all this can affect the sexual health of a woman. So what did you experience? Please share this. How do you resolve it? What are the things? Did you seek help? So like I said, there are a lot of problems that women have, challenge that women have postpartumly. So what do you think? How do you resolve it? What did you experience? Some women at this time, there's a time of, like I would say, depression. So when some women experience postpartum depression at this time, just because of the enormous what will I call it now, the challenges, the responsibility of childbirth, and this bring about sexual dysfunction. So sexual dysfunction is classified as disorders of sexual desire, arousal, orgasm, or pain. So, however, in the postpartum period, the most common disorder appears to be that of sexual pain. So, and this can be as a consequence of the perineal trauma. So, healthcare workers, as in general, like our advice that this is the time that we need to educate the woman, especially if even during pregnancy, of the challenges that they can face. So, following childbirth, many physical, emotional, and hormonal changes occur, and all this can have an impact on the woman's sexual health. This include painful sex. It may be due to the healing stitches or infection, and this can lead to low mood. It can lead to depression and all that. So like I said, so this is a time for you to discuss this issue. That is why we are doing this. We are having this discussion. That's why I'm doing this video. Let's discuss this issue. What did you go through? What are the challenges you're facing, and are you seeking help? It's not everything we get silent about, because there can be complications to this. It can affect your marriage. It can affect your own health in the long run. So please, let's discuss this. So women that deliver vaginally, some people say they demonstrate significant decrease in desires. I've mentioned that. Okay, I'm going to go to the next thing. So approximate and timely advice on the use of lubricant. Now that's where I'm going. Like, how do you resolve this challenge? Some women use lubricants in cases of vaginal dryness. So you need to check the lubricant you're using, water-based, whatever. Just make sure that they're not the ones that are harmful. You might need to check with a pharmacist or with a doctor. Some use estrogen pessaries, that's like an hormone that can help to increase the sexual desire. And like I said, open communication with your partner, it's very important. And breastfeeding can also help you to improve your sexual health. So that's why we encourage you to breastfeed your children. So in conclusion, I'm just going to conclude here that it is important that as women that we seek help to meet our individual sexual need. Don't keep quiet. It is not only the man that will express sexual desire or sexual or sexual feelings. So it should be mutual. It should be mutual. And if you experience any changes in your body that you feel is out of normal, please seek help. Once again, I'm going to round it up here. I'm Olayinka Aremu. If you have any questions, just pop in the questions, send it in there, and then I will respond to you. Okay. Also, please share this video to everyone, and I hope this blessed somebody. Thank you.